Welcome to this Links training and support webinar on responding to harmful sexual behaviours displayed by kids in out-of-home care. I'd like to start by acknowledging the original custodians of the land on which I'm recording this webinar and the lands on which you're watching. I'd also like to pay my respects to elders past, present and emerging. During this webinar, I'm talking about harmful sexual behaviours and you may experience some strong feelings. If you notice that you're finding it difficult to stay present, there are lots of different ways to regulate. You could try centering yourself using a fidget toy or doodling, taking a few slow breaths, pausing the webinar, standing or moving around as you watch, or having a drink or something to eat. For those who haven't seen our previous webinars or would just like a refresher, harmful sexual behaviours are displayed by kids under 18 years of age. These behaviours are outside what is culturally accepted as developmentally typical, may be obsessive, compulsive, coercive, secretive, aggressive or violent, might involve a substantial difference in the age or developmental ability of those involved, and can be harmful to those displaying the behaviours or others. Adults may discover harmful sexual behaviours in a range of ways. Behaviours might be directly seen or reported, including specific disclosures of sexual harm by kids. Adults could also come across images or messages on devices. It's natural to feel shocked or concerned by these discoveries, but the earlier you respond, the better the outcomes can be. If you become aware of harmful sexual behaviours or have concerns about kids you're supporting, it's important to take action. If you're a carer, the first step is to speak with your caseworker, or if you don't currently have one, call the Child Protection Helpline. All carers and caseworkers should be aware of their mandatory reporting obligations. It's important that initial conversations around behaviours are effective. To support these discussions, we've developed a harmful sexual behaviour identification sheet, which can be found on our website. This sheet will help you gather information about how and when behaviours occur, and may inform casework decisions about what happens next. Once caseworkers are informed about harmful sexual behaviours, they may gather more information to determine the severity of the behaviours. Caseworkers might enlist help from psychologists or other specialists to inform the next steps. When harmful sexual behaviours are discovered, it might be tempting to confide in family, friends and colleagues. In some cases, this may be appropriate, but it's important to consider who really needs to know. Confidentiality is important for all kids, but it's crucial for those in out-of-home care that display harmful sexual behaviours. If this information is shared inappropriately, kids can experience increased stigma, shame and mistrust, making it difficult for them to engage in supports. Together, carers and caseworkers should determine who needs to be told about the behaviours. Generally, the only people who should be told are those providing supervision. This might include teachers, respite carers, and others supporting kids who display harmful sexual behaviours. Please remember that not everyone in their community, extended family, and social networks needs to know. A number of things may occur following the discovery of harmful sexual behaviours, and these steps will depend on the severity of the behaviours. Caseworkers will often provide referrals and supports for both kids and their carers. The situation may also be investigated by caseworkers, the New South Wales Police, or a specialist multidisciplinary team. To reduce the likelihood that the behaviours will continue, specific supports and therapy are often implemented. These may include increased safety and prevention strategies in the home and community, therapeutic assessment and treatment, strengthening skills, increasing stability, and building support networks. The early days after discovery of behaviours can be stressful for caregivers. It's important that caseworkers and carers work as a team to ensure that everyone affected receives the support that they need. It is common to have an emotional reaction to the discovery of harmful sexual behaviours. Research indicates that those supporting kids with harmful sexual behaviours can experience a range of emotions, including shock, worry, guilt, anger, and helplessness. It's completely normal to experience these or other responses, especially when behaviours are first discovered. Your emotions and reactions will depend on your history and personal experiences, stress levels, available supports, and understanding of the behaviours. Strong emotions can have an impact on your own well-being. If this impact is ongoing or makes your support role more difficult, it's important to seek help. Take time to look after yourself and implement self-care strategies every day. This might include relaxation strategies, exercise, taking time out, and socialising. Looking after yourself makes it easier to look after others. When kids display harmful sexual behaviours, it's important to respond appropriately and keep those around them safe. This involves implementing specific strategies both at home and in the community. These strategies can include safety plans, supervision, and rules and boundaries. I'll talk more about each of these elements in more detail now. Safety plans are written documents developed for kids with harmful sexual behaviours. They are individualised to identify and address risks relating to the specific behaviours of concern. These plans help to reduce the ongoing harmful sexual behaviours occurring in the home and community. They aim to keep both those displaying the behaviours and others around them safe. Safety plans may be developed by a number of different people, including caseworkers and therapists. Wherever possible, carers should be involved in the development of a plan to ensure they can understand and implement it successfully. Kids should be aware that a safety plan has been written about them and understand the information it contains. When a safety plan is in place, all supporting adults must have access and ensure they understand its strategies and expectations. Caseworkers should work with carers to understand any concerns with the plan or any ongoing behaviours so that strategies can be updated. Plans should also be reviewed regularly, including as behaviours change, as treatment progresses, or if strategies are unsuccessful. Carers are often required to take an active role in the supervision and monitoring of kids with harmful sexual behaviours. This supervision is required both at home and in the community to prevent further behaviours and keep others safe. For this reason, supervision and monitoring are important components of every safety plan. Adults are often required to observe kids with harmful sexual behaviours, knowing where they are, what they're doing, and who they're with. Plans sometimes require line of sight supervision, which means that supervisors must maintain vision at all times. Supervision not only occurs around other kids, it may include supporting safe use of technology if this is an identified concern. Communication between carers and caseworkers is vital to ensure that supervision strategies are working and supports can be implemented. As monitoring is expected 24 hours a day, 7 days a week, it's important to develop strategies around managing supervision to reduce additional stresses. Carers may benefit from increased supports or respite so the whole household can participate in daily activities. Implementing clear rules and boundaries can assist with supervision and monitoring while increasing safety for kids with harmful sexual behaviours and others. In a safety plan, rules and boundaries may be written as safe family rules. Safe family rules are usually written and reinforced using positive, child-friendly language so kids know what is expected of them. More information about the development of rules and boundaries is available in our webinar, Strategies to Prevent Harmful Sexual Behaviours. We've looked at some strategies that might be implemented to increase safety and prevent harm. Now let's look at therapeutic supports for kids with harmful sexual behaviours. All kids in out-of-home care, but especially those with harmful sexual behaviours, benefit from therapeutic supports. Harmful sexual behaviours have a significant impact on the kids who display them. Impacts can include loss of privacy and independence, reduced visits with family and siblings, increased mental health issues such as depression or anxiety, contact with the criminal justice system, changes in placement, and social isolation. Therapeutic supports can reduce these impacts while also reducing the occurrence of harmful sexual behaviours. Following effective intervention, most kids do not continue to display these behaviours. Research shows that therapeutic interventions for harmful sexual behaviours are more successful when caregivers are involved. Kids with harmful sexual behaviours often have additional support needs associated with trauma, mental health, social skills, and other behavioural concerns. Where these are identified, therapeutic supports should be implemented to address these needs. Of course, not all kids will find it easy to attend and participate in therapy. The motivation to participate in therapy is negatively impacted when caregivers do not support treatment. This results in poorer outcomes for kids. It's important that carers and caseworkers support kids to achieve positive outcomes in their behaviours through therapy. Thank you for watching this webinar. You'll find further information and webinars on harmful sexual behaviours on our website. Our website also has a range of resources on trauma-informed care, which is a key strategy to help prevent harmful sexual behaviours. Thank you.